Inflammatory bowel disease (IBD) refers to Crohn's disease and ulcerative colitis, to long-term conditions that involve inflammation of the digestive tract or gut. It can lead to a range of digestive symptoms. Now we will discuss the types of IBD. The two main types of IBD are ulcerative colitis and Crohn's disease. Now let's first discuss the ulcerative colitis. This condition causes inflammation in the large intestine or colon. There are several different classes of ulcerative colitis depending upon location as well as severity. Ulcerative proctitis. This type occurs when inflammation stays within the rectum. It tends to be the mildest form of ulcerative colitis. Then universal colitis or pancolitis. This type occurs when inflammation spreads across the entire colon. Proctosigmoiditis. This type occurs when the rectum and the lower end of the colon experience inflammation. Distal colitis. This type occurs when inflammation extends from rectum and up to the left colon. Acute and severe ulcerative colitis. This is a rare type that causes inflammation across the entire colon, leading to severe symptoms and pain. Now Crohn's disease. Crohn's disease can affect any part of the digestive tract between the mouth and the anus. However, it most commonly develops in the final section of the small intestine and colon. Now let's discuss causes and risk factors. Several factors can contribute to development of IBD. For example, it may occur because the immune system has an irregular response to the bacteria, viruses, or food particles. This can trigger an inflammatory reaction in the gut. Now just let us know what are the risk factors for ulcerative colitis. Age. Most people receive a diagnosis at around 20 years or after 60 years of age. Ethnicity. People of Jewish descent seems to have a higher risk of ulcerative colitis than other ethnic groups. Genetics. People with a close relative who has ulcerative colitis have high risk of developing it themselves. Now risk factors for Crohn's disease. Genetics. People who have a parent or sibling with Crohn's disease are more likely to develop it themselves. Medications. The use of non-steroidal anti-inflammatory drugs, NSAIDs, birth control pills, and certain antibiotics may increase the risk of Crohn's disease. Smoking. This habit can increase or double the risk of Crohn's disease. Diet. A diet that contains high levels of the fat can also increase the risk of Crohn's disease. Now what are the symptoms? The symptoms of IBD may vary according to the type, location, and severity. People might experience periods when symptoms worsen or flares, and periods with few or no symptoms, that is remission. Flares may vary in amount, intensity, and duration. The following symptoms are common to both main types of the IBD, such as blood in the stool could be there. Then persistent diarrhea, fatigue, weight loss, fever, joint pain, and certain skin conditions. IBD can make the effects of menstruation more severe, and that IBD symptoms may also get worse during menstruation. IBD also increases women's risk of iron deficiency anemia. Complications. Some possible complications of Crohn's disease include bowel obstruction, colorectal cancer, fistulas, which are abnormal tunnels in the gut, small tears in the anus or anal fissure, ulcers in the mouth, intestine, anus or perineum, which is the area between the genitals and anus, malnutrition. They also suggest that ulcerative colitis can cause certain complications such as rectal bleeding, which may lead to iron deficiency anemia, dehydration, poor absorption of the nutrients, reduced bone density, possibly lead to osteopenia or osteoporosis, development of kidney stones. Now let us discuss the diagnosis. To diagnose IBD, a health professional will take a full medical history before requesting one or more diagnostic tests. Some tests, which may include like stool samples, blood tests to check for anemia or infection, x-rays if you are suspecting some complications, CT or MRI scans to detect fistulas in the small intestine or anal regions. Some types of endoscopic procedure a health professional may use to diagnose IBD, which includes colonoscopy. They use this to basically examine the entire colon. Then flexible sigmoidoscopy. It helps them to check the final section of the colon, that is the distal part. And upper GI endoscopy. This procedure allows to examine the esophagus, stomach, and first part of the small intestine. Now let us discuss the treatment. The goal of treatment will be to reduce the symptoms, achieve and maintain remission, and prevent the complications. Doctors may prescribe certain drugs to treat IBD, beginning with milder ones and working up to more aggressive treatments later on. These medications may include such as mesalamine can be given as initial therapy both for induction as well as remission. Then step-up therapy for steroids. The doctor may prescribe fast-acting anti-inflammatory steroids. If a milder class of anti-inflammatory is not that effective, people should only use these drugs short-term to treat the flares. Long-term use of NSAIDs or steroids may make IBD more worse. Now, immune suppressors. These work by preventing the immune system from attacking the bowel cells, leading to reduced inflammation. However, they can take around 3 months to take effect, and that may cause a number of side effects such as increased risk of certain infections. Then biological therapies. These are antibodies that target certain substances that cause inflammation in the body. Last but not least, surgery. In some cases, like refractory cases, surgery may be necessary to treat IBD or its complications. People with ulcerative colitis may need to undergo surgery to remove the antricolon or as well as rectum sometimes. Those with Crohn's disease may need a procedure to remove certain portions of or part of the intestines. Then certain lifestyle changes. Dietary lifestyle changes can actually make IBD symptoms sometimes more worse. However, making positive changes to these habits can help a person manage the symptoms and reduce flares and even maintain the remission. Some dietary measures that may benefit people with IBD include like keeping a food diary to track whether or not certain symptoms occur after eating certain kind of the foods. Then limiting the intake of dairy products, restricting the intake of high-fat foods, avoiding or limiting the intake of spicy meals, caffeine and alcohol, limiting the intake of high fiber foods, particularly if the bowel has narrowed down, eating frequent small meals rather than several large meals, drinking plenty of the water, taking vitamin and mineral supplements to prevent deficiencies. So friend, these are the certain symptoms and signs which we have discussed regarding the IBD. So one can take care of these symptoms earlier so that one might get the best treatment at a very earlier time and prevent certain complications. Thanks for watching.